You're listening to Three Makes Baby, a podcast about fertility, family, and genetics. I'm Jana Repnow, a fertility counselor and author of Three Makes Baby. Welcome to the show. Hi, everyone. I am back today with a very special guest. I have Dr. Diane Tober here with me today. I've been talking about having Diane on for a while because it's something I've been really excited about. We connected through Ryan, another podcast guest. She put us in contact. Thanks, Ryan. And it's really great because we have been doing a lot of similar work kind of over the years. And I'm really glad to finally cross paths with you, Dr. Tober. Diane. Yeah. So I want to tell you a little bit about Dr. Tober. She is the assistant professor at the University of California, San Francisco, the Institute for Health and Aging. She's also faculty at Bixby Center for Reproductive Health and in the Department of Anthropology, History, and Social Medicine. So Dr. Tober has done some amazing, research and that she's in the middle of, and we'll get into that a little bit more. And she's also the author of Romancing the Sperm, which I'm reading right now. I told her that I'm almost done with it. I'm kind of halfway through. And it is available. You can buy that on Amazon. And you can also, I'll give you a link in the show notes that you can buy that book. And this is a book about the shifting biopolitics and making of modern families. So it's so interesting. I've been really fascinating to learn more about the history really of sperm donation and just all the nuanced information that it's really difficult to find out there. So I've really enjoyed your book a lot. It's been great. Yeah. I'm so glad we're talking today because we had a brief conversation on the phone and I already learned so much from you. I just think you have a wealth of knowledge on this topic and I would love to hear more about what you know and to be able to share some of your work with my audience so they can get to know you too. And I'll also share how you can get in touch with her at the end of the show and how you can connect with her too if you want to on social media or through email. But so Dr. Tober, you've done a lot of research. So I kind of want to start with that and just, what you have researched over the years and what your focus has been on and how it's shifted too.
Right. Yeah. Well, and thank you for that wonderful introduction. I'm happy to be here and sharing my interests with everybody. So back when I was a graduate student, I was at University of California, Berkeley and UC San Francisco, and I was working on a project that looked at gender differences in response to infertility. And that project focused on how heterosexual couples, usually married couples, processed the emotions surrounding, feelings of failure, feelings of stigma, especially when their own gametes didn't work, letting down their partner, coming to terms with the idea of using donor sperm or donor egg. And this was back in about 1989 when I first started this work. And as a research assistant. And one of the things that struck me as I was interviewing infertile couples, and again, mostly heterosexual couples, is that people were calling up to volunteer for the research project that fell out of the scope of sort of the heterosexual married couple. And so single women were calling up, wanting to volunteer to participate in the study. Lesbian couples were calling up to volunteer to participate in the study that were also experiencing infertility. And at the time, nobody really thought about infertility as something beyond sort of the heteronormative structure. And that really started me thinking back then about, wow, this is really interesting. How do people beyond those, male-female partnerships think about their fertility, experience infertility, and what do they do when they're experiencing infertility, right? Mm-hmm. And so at this time, when I first started the work, single women and lesbian couples were often screened out of being able to receive fertility
treatment.
Exactly. Wow. Yes. So if somebody needed a sperm donor, for example, they would have to come and stand in with somebody who would pretend to be sort of their infertile partner.
Okay.
And women people in these situations had to jump through a lot of hoops to try to be able to get access to treatment. And I was really curious about not only already dealing with the challenges of infertility as a single woman or as part of a female couple, but also what were the barriers to access and how do people overcome those barriers. So for people that were not in these heterosexual married or couple relationships, they had a whole other level of challenges to getting access to treatment.
Yeah.
And so that started me for my dissertation project, which turned into this book. That started me in interviewing single women and lesbian couples and their experiences with trying to access donor sperm. And from there, I also started doing some field work in some of the local sperm banks and looking at how different policies in these sperm banks were sort of framed by the personal philosophies and values of the founders. And then I also from there added in speaking to sperm donors and how they think about sperm donation, they think about the genetic material, and also how they manage sexuality in the context of being a sperm donor, sexuality and receiving pay for providing sperm and things like that.
Yeah.
So the project started off with this focus that just kept growing from there as the research developed. Yeah.
Oh yeah. And it's so complex and there's so many aspects to it that you learn as you go. So
Yeah.
you found in the beginning that sperm donation was really, and clinics that open to provide sperm for the this clientele that wasn't receiving treatment, they had their own philosophies that reflected them as people too, right? And some of it was involved, some of it had to do with specific characteristics, didn't it?
Yeah. Well, in terms of the procedures and policies of the individual sperm banks, you mean?
Yes.
Yes. So, for example, in the book, I pretty much compare 3 different sperm banks. I did do work in more than those 3, but these 3 really stood out to me as having sort of diametrically or dramatically different approaches to who they selected as sperm donors and who they would provide sperm to. So, for example, in Berkeley, where I live, the Sperm Bank of California was founded in about 1986 by a women's health collective, and their prime motivation was to make family building options available to people regardless of sexual orientation and partnership.
Okay.
So it was founded with the intention of being able to provide sperm to predominantly single women and lesbian couples, the very people who were screened out at that time from most fertility clinics and most sperm banks. A number of years later, the Rainbow Flag Health Services came along, and they specifically were focusing on building lesbian gay families through sperm donation. So, for example, their donors were predominantly bisexual or homosexual men, and the recipients were predominantly bisexual or homosexual women, and also transgender people within that whole dynamic.
Yeah.
And again, the founding philosophy of that bank was to build LGBTQ families through sperm donation. And they actually had a policy that permitted donors and recipients to meet beforehand, and for the donors to be able to meet the child, any children born within 3 months.
That's pretty progressive.
Very progressive, Whereas, and Sperm Bank of California was the first really to offer what they call identity release sperm, where a child could meet their donor at age 18 if they so chose. And then on the other side of that, I went to the Repository for Germinal Choice, which was a very it was in the popular press, it was called, the genius sperm bank, right?
Yes.
And it had a very eugenic message, wanting to get the sperm of the so-called the best, most intelligent genius men, Nobel laureates and so on. And
was that the blonde hair, blue-eyed?
Predominantly blonde hair, blue-eyed. And when I first walked into that sperm bank, I was really struck because the photos on the wall, it blew me away. I wrote about it in the book, but
I had a visual of you walking down the hall. I could see those pictures and you processing that and going, wait a minute, what's happening here?
Exactly. And I still almost 30 years later, I still tangibly feel in my body the impact of walking in there and seeing those photographs of all those blonde hair, blue-eyed children just smack me in the face practically.
A little haunting, isn't it? Yeah.
It was very interesting. And and I know some of the donors who donated through there, and they didn't see it the same way at all, because and one person happens to be an acquaintance of mine, and in his perspective, he was doing something, really altruistic and so on, but
Mm-hmm.
those donors weren't paid. He wanted to help. He also
Mm-hmm.
later, it turned out, came out as a gay man himself. So it's kind of
Mm-hmm.
ironic that here the sperm bank was trying to filter out
Oh, wow.
homosexual people, and
And
in
then,
fact, they had,
yeah,
yeah.
yeah,
So,
yeah.
so the policies that the founders tried to institute that are discriminatory obviously don't always work. And that's one of the things I think is so fascinating in my book, is that
Mm-hmm.
how people worked around these barriers in
Yeah.
order to be able to access the care that they wanted and needed. So,
Oh, that makes sense.
yeah.
And what I
So,
noticed also when you were talking about the process of sperm, you know, qualification, I guess, for lack of a better way to say it, is that there was a criteria that they had to go through, and that very few donors actually were qualified to be donors after this process. And it was a screening process. But what I didn't see was like a psychological. It was more of a medical screening process,
right.
not a psychological screening. Is that right?
That's correct. Most of the sperm banks where I conducted some field work and some interviews, most of them put the donors through. They tested the sperm. They see how plentiful the sperm is. What the mobility and the motility are.
Mm-hmm.
They see, then they freeze it, and they see what the survival rate is after it's thawed. And then they also do the medical screening, such as blood work and STD. Screening out for STDs.
Mm-hmm.
Didn't really do too much in the way of genetic screening at the time. And but one of the laws that I talk about in the book at the time, and that gay men were barred from being men who had sex with men were barred from being sperm donors, because that was in the height of the HIV crisis.
Yeah.
And so, for example, Leland, one of the characters in the book, had to really go through quite a bit in order to be able to have male sperm providers that men that had sex with men.
Mm-hmm. Yeah. And that was the Rainbow organization.
Flag.
Yeah. Yeah. And sperm donors were, so they were tested, I think you said something maybe like less than 10% were actually accepted.
Right.
Yeah.
And it pretty much had to come down to, there's certain things that were selected for in terms of, education kind of screening to some degree, height requirements, for example. Most sperm banks didn't want men that were too short. And interestingly, and it's very interesting because, so for example, one of the things people often talked about, especially as many of the women in my book that I interviewed, is that the lack of ability to find quote unquote ethnic sperm, from men of different ancestral backgrounds. And so if I had a Latina couple or somebody who was Latina and wanted to find a Mexican donor, it might be very difficult because they might not necessarily meet the height requirement,
oh my goodness.
Right. And same with Asian men. And so some of the sperm banks actually lowered the height requirement in different groups, but most of them still kept a height requirement of like 5'10", 5'11", and higher. So it's really interesting. And when you look at egg donation, you don't see a height requirement like that.
No.
And the height can be equally inherited from your female line as it can from the male line. It's equally.
Trust me, I know my poor son got my husband's 6'2", I'm 5'2", and my son, I brought that down.
Yeah.
So yeah, it definitely can come from both sides. You're right, and and it is interesting how we put those stereotypes on men and women, even within this. Donation with gamete donation.
Oh, absolutely. And now that I'm comparing, my current research on egg donation, is fascinating to see how the kinds of information and the kinds of screening processes with egg donors versus sperm donors, and how they vary in these two different scenarios.
What stands out the most and how they vary?
What stands out the most to me is that with egg donors, you get a ton of visual information. And so you'll get, photographs from infancy all the way up to, current age. Sometimes you'll even get swim shot photos. You might get modeling shots. Sometimes you get videos. There's a vast amount of visual information you get on an egg donor. Whereas with sperm donors, there's comparatively very little information. You might get, in some of the sperm donors, you might get sort of a shot of them when they were a child,
Mm-hmm.
but very, very little in the way of current photos. And so, obviously, to me, that sort of points to the pressure on females, to conform in a gendered way, and present in a very sort of, are they attractive enough? And this
Oh no.
having a pretty
Yeah.
donor. Yeah.
Oh boy. I
Whereas
know I
with,
was waiting for that. I'm like, what, trying to think about what that would be about, and it was a different time. Egg donation is more recent, but
yeah,
still it makes sense that you've got that gender stereotype and the pressure
yeah,
that are put on females versus
yeah,
men to be tall and women to be beautiful. It's kind of,
exactly.
which is silly because look at all the different types of women and men out there and different heights and looks.
Yeah,
And
yeah.
it's wild. So, yeah. So I was thinking about, unless you wanted to say something to expand on
I
that.
had a point, but I forgot it now, so that's
Oh
okay.
gosh, I know I do that too.
Yeah.
But I was thinking about also, you mentioned you served single women.
Mhm.
So that single women were having a hard time being served as well. And I know today, I mean, I live in Texas,
Mhm.
and I know of a doctor recently, as of a few years ago, that would not serve gay clients, gay and lesbian
Wow.
clients. So it still happens today. Let's hope not that much, but
Yeah.
it still happens today, which it seems unbelievable. But
Yeah.
it does. So, and then the same could be for single women too. It depends, the clinic it's up to them as to who they will serve. Did you run into that when you were first looking at the population? Is the same thing with single women and
Oh, absolutely.
yeah, that,
Absolutely. Kind of like, and then, and so many single women that were straight were looking at this as their last
chance.
chance.
Yeah. So for single women that, what type of, did they talk to you about some of the challenges that they faced and the, you know, judgment or,
Absolutely. Yeah, yeah. Single women that, also experienced a lot of stigma,
Mhm.
and feelings of like, what's wrong with me that I couldn't find the right man, you know, and feeling a lot of remorse, and that they
Mhm.
basically mourn the loss of doing it the right way, and then but then when they finally get to the point, like I had one woman that told me that, you know went to school, I got my degrees, I have a good job, I've got
Mhm.
money in the bank, and I can buy the white picket fence if I want. So I
Mhm.
had this dream of doing this with a partner, but you know, if this is the only way to do it, that's how I'm going. I want to have a child. And that the idea of
Mhm.
not being able to be a mother just because they didn't have a partner, it's like that didn't make sense to them. And it was really interesting to me at the time too, is when I was doing some of these earlier interviews, I was about 5 years younger than many of the women that I was interviewing. I was about
Mhm.
30, and most of the people I was interviewing were 35 to 40 or so. And it was really interesting to me thinking about some of the challenges we had, like at the time of, can we confront these societal norms? Can we overcome the societal norms to become a parent and live our lives the way we want to? And
Yeah.
what are the obstacles to that? And how do we
Mhm.
overcome them? So
Yeah, that's a great question. Now, have you followed up with any of those that you interviewed back then?
I have,
Mhm.
especially, there's one woman that I actually interviewed for more near the end of the book, looking at some of the changes that have happened over the past however many years. And I followed up with Leland again from the Rainbow Flag near the end of the book, and also
Mhm.
Barbara Boy from the Sperm Bank of California, and Alice Ruby from the Sperm Bank of California. So I did some follow-up interviews to bring it up to date. So the book, it actually has sort of a 20-something year history of information about how things have changed from the 1990s to today.
Amazing.
Yeah.
Oh, what a just robust, all in one place to get your history.
Yeah.
For any of those I get people reach out to me all the time that want to counsel in this niche, and they ask me, where do I start? Where do I learn?
Yeah.
That's where you start, right there. Read Dr. Tober's book,
Oh, thank
because it will. There are things in there that I have been doing this for 10 years, and I learned from reading your book. So I wish I had found it sooner. So
oh, thank
yeah, yeah. Um, so yeah, tell me a little bit about the research that you're doing now,
Yeah.
because I know that you're still researching, and I'm
Oh, yeah.
excited about it. Yeah.
Yeah. So, um, About 2013, an egg donor from a group called We Are Egg Donors. She was one of the co-founders of We Are Egg Donors. Contacted me, and we had lunch, and I believe she had known about my earlier work on sperm donation, and so we started talking in it. And she had just founded this group and had about 30 people in it. And it turned out that many of the egg donors in her group had some complications. And a variety of other issues that had happened in terms of contracts gone awry and a number of things that had happened. And so we decided at the time to collaborate on trying to get some research done on egg donors' decisions and experiences in health and well-being. And so back in about 2014, I returned to University of California, San Francisco, in order to launch what, as far as I know now, is the largest mixed method study on egg donors anywhere.
Oh,
so,
unbelievable.
Yeah,
I feel like we need the applause sound in the background.
Yeah.
Or maybe I'll put that in, because I think I know how. I mean, I couldn't be happier. There's been, how many times it's come out of my mouth, I've said to egg donors that I interview and evaluate, we don't have any long-term studies. We don't have any long-term studies. This is what, we know now, but that could change because we don't have any long-term studies. And now you're doing it. And I'm so excited, because that's what I've been wishing for and wanting and to see happen. So that's amazing.
Well, and that's the interesting thing to me is that, in this group, one of the things I kept hearing were we don't have any long-term studies, and they were frustrated by that. And then I would read, academic articles, there's no long-term studies. And they've been saying this for 20 something, almost 30 years.
Have they really? Oh my
and
gosh.
I'm like, well, why isn't any 30 years? We're all complaining about no long-term studies and nobody's doing it.
Nobody's doing it. Yeah.
I'm like, okay, I guess I'll do it. And so
You'll be the one.
left the job that I had. I returned to research in order to do this, and it's been a huge uphill battle in so many ways, personally and financially. But I now have 500 egg donors in my study.
That's
and
amazing.
I'm just going to start tracking them over. I want to start tracking them over time. And I have a survey component, and I've interviewed another 120 of them, and I have 180 people waiting to be interviewed. The interesting thing is they're not just from the United States, they're from around the world. And so I have egg donors I've interviewed from Australia, South Africa, Canada, Spain. I have a grant that's comparing egg donation in the United States and Spain with very different regulatory practices. And so I've got this global perspective, so I can see through the donors' experiences how things are operating differently in different locations. And for example, most of the donors that I'm seeing, say for example from Australia, they're reporting pretty conservative egg counts per cycle. So 10 to 15, no more than that, and that's considered to be high. Whereas in the US population of egg donors, I'm seeing numbers above the 30s to 80s. And so that's telling me that there's something going on with practice here that's very different than some other parts of the world. And then how does that affect the donors' experiences? So
how does it affect them long term? That's one thing when donors come and ask me, and their husbands are with them, and they'll say, usually the husband's main concern, honestly, is my wife's health. He said, he'll ask me, well, how is this going to affect my wife's health? I really do want to help another family. It's a wonderful thing, but I do worry about her health. And that's when I have to do my thing. Well, there's no long-term studies, which I am so tired of saying. So now I get to now I'm not going to say that anymore. Now I'm going to say, well, we do have a long
studying process.
In process. And if you decide to be an donor and you would like to join that, here's how you join that study. And that will help women like you and families like you long-term to just know the risks and to be better informed going into the medical process and to even advocate for themselves better. So, let's say they do have information that, they don't want to have as many eggs retrieved, or, that's just one example I know, and I'm not a doctor. So that don't take that one to the bank, but that they have more information, they can take that information and just ask more questions and say, could we do it this way? Exactly. Or this runs in my family, and I've learned that this may be a risk factor. Is there a way we can reduce or minimize this risk factor? So it's not putting kibosh on the whole thing. It's actually just making it better.
Exactly. And, that's really interesting. I know, like, you interviewed Ryan and I interviewed Ryan as well. But one of the things I was so impressed is even when I heard her tell her story on your podcast was just how she became so informed, and in that process of gathering information, she really found her own voice and her own way to advocate for herself. And I often think, I'm working on my next book on egg donation right now, and in one of the chapters is going to be called Just Eggs. And what I mean by just is how, if you look at egg donation and justice and so on, is there a way of practicing in a way that has the same values of justice, and self-advocacy? And that's one of the things that I'm really looking forward to sort of fleshing out in my brain and also on paper. But
and the ambiguity of it too, is that when people say, well, it's just an egg. Right. It's nothing more than just an egg. So there's that too. So you can say there's a lot there just in that title. There's a lot there that can be discussed.
Yeah. And and what's one of the things that egg donors tell me all the time too is like, oh, well, the recruiter told me, it's just a cell, it's just another piece of my body, like blood or whatever, and so on. And that language gets internalized.
Yes, it does.
And in a way that sort of reframes how people think about what education is and what the product of that process is.
Yeah.
And it's interesting because, I've also talked to a number of donor-conceived people, and some of them, are happy and fine and so on, but some are also angry at sort of being a transaction. And feeling like they were sold or that they were given away, or a number of emotions can come up just like they do for people of adoption. And I think some of that clinical discourse that puts that distance between donor and cell, and then ascribes the relationship to the recipient parent and the child and so on. I think it does something in the whole process.
Well, it dehumanizes it a bit. And I think it's because when we say it's just a cell, and that is true. And I've heard so many people say that, by the way. So, and I understand where you're coming from when you say that. And so I think a lot of times they're just lacking that education around it, because if you can think to your own identity and your own traits, we just forget that there's a big genetic piece to that, and that we're already past that point of identity development. So we forget about that phase. And we forget what it took to kind of achieve a successful identity development. And we can have all types of identity development that goes awry and doesn't go well. And this is an area where it is not just a cell. It is so much more than a cell, because it is a cell that is expressed in your traits and who you are. And when you're searching for yourself, you do sometimes need that mirroring or those guideposts to check in with and say, is this me? Who am I? Things like that. And so that's when it's more than a cell. And then there may be more than times in your life when you're well past that, where it's not as relevant anymore. So,
and one of the things that I see, especially in some of the older former donors, is like, so yes, obviously, an egg is a cell, a sperm is a cell, and they're not, and they, an embryo is a cluster of cells. But down the road, so for example, if a child is born and live birth and so on and develops, and that egg donor later goes on to have her own children or has her own children or whatever, I find that many of my older egg donors over time are looking back on their donations differently than they did when they were 20. So I've had donors tell me things like, let's say a 40 or 50-year-old donor is like, well, I used to think that it was just a cell and it wasn't my baby. But now that I have my own child, I think of that child all the time as my child's half sibling, and I wonder about him or her, and I wonder if they're okay, if they're with a good family. I'd like to meet them. And so the emotion around the donation may change over time for people, and that's something that people don't know when they're 20 years old and going into it because they have college debt or whatever the case may be.
Such a good point. Such a great point. Because then I interviewed a lady in a clinic who they want their donors to be mothers first. So they
Right.
don't allow any donors before that. And then you have other clinics that, that are allowing donation at 18.
I know.
So it's like, and that's in different parts of the world. But yeah, so I think it is important to know that your attitudes and feelings can change over time,
Yeah.
and that what you think now may not be what you think in the future. And yeah, so that counseling is so important to get that. And yeah, so in terms of like what you've seen, because it's so great that you have this follow-up knowledge. So like I see them one time and then I don't get to talk to them again, and I don't know how they are doing 20 years later. And it's
Right.
something I've always wanted to, like, I just wish I could follow up, and because then
Yeah.
it would give me better information on how to counsel and how to interact with people.
Yeah.
So that's why I'm excited to learn this from you,
Yeah.
as what they are saying later.
Yeah.
And but also, what would they say to you about, a lot of times the agencies and clinics are really more proponents for closed or anonymous. They're calling it anonymous. It's not anonymous anymore. We all know that, but
Yeah.
they're not allowing the parents and the donor to meet. They're kind of making it difficult even.
Mhm.
And they even tell a lot of parents that I interview that the donor is not open, that they are anonymous. And then I'll speak to donors, and the donors will say, no, I'm actually open. I'm fine to meet. Most donors I've met with are fine with being open. They're fine they understand the child might want to know who they are. So what is happening? And have you found that disconnect as well in the communicate?
Absolutely.
Yeah.
Yeah, absolutely. In my study, like I said, of 500 or so donors at this point, about 90% want to be open, and many of those want to be known from the outset.
Oh, wow.
And they're being told that nope, either the clinic policy is only to have anonymous, and nothing can, no information about identity or anything can ever come out. So, some are told that it can't ever come out, not even at 18, but ever. Um, they're not always necessarily even counseled on the fact that direct-to-consumer genetic testing could, pull the lid off of being anonymous, either. And then a number of donors that I've spoken to have actually persisted. And then at the same time, the recipient parents had persisted, and they managed to convince the clinics or agencies to help them get connected. And they both found out later, well, they told me that you wanted to be anonymous, and oh, well, they told me you wanted to be anonymous. And so the same kind of things like what you're
Yeah.
saying. But
Yeah.
from what I've seen, so far, the majority of the donors in my study do not want to be anonymous. They would prefer to be open. And
Okay.
what I
That's good.
am kind of saying at this point is that obviously, with the lack of anonymity, if somebody doesn't want to be open or known at some point, they probably should decide that, think again as to whether or not egg donation is
Yeah.
the right decision for them, because there's no way of maintaining their privacy or not anonymity at this point anyway.
Yeah, exactly. Exactly. And, I know that here in the US, especially, with there's direct to consumer DNA tests are very popular. And, you can almost I hear all the time of people getting them as a Christmas gift and then finding out they were donor conceived. I mean,
Yeah.
it's amazing. Like,
Yeah.
I've had Allie on my podcast, and she says how, yeah, we usually expect in January, we're going to have an influx of new siblings because they're going to get it for Christmas and they're going to find out that they're donor conceived. I wonder I know in other parts of the world where there's maybe less testing at this point, it may be a little bit slower for that to eventually happen. Cause I know there are people that listen from, countries from Russia, from Ireland and England and Australia. So, it will vary from area to area, but not much probably, right? I mean, the technology is moving so fast and reaching areas, it won't be long
Exactly.
before it's impossible everywhere to be anonymous.
Yeah,
Yeah.
and that's really interesting to me. I know UK recently lifted the anonymity. It made it so people had to
Yes,
be
they did.
in the registry. But in Spain, they've been really grappling with this issue, and that's one of the things that I'm looking at in my current research. I have a National Science Foundation grant that's comparing, like I said, egg donation in the United States and Spain, and looking at how these different regulations, not only how they were developed and how they're enacted, on the ground through clinics and through reproductive practice, but also how they play into donors' decisions and experiences. So,
Okay.
and one of the things that Spain is really grappling with is, what to do about anonymity.
Mm-hmm.
And it's a huge discussion. It's often a very passionate discussion because there's some people that are very, very committed to the long-standing
Anonymity.
anonymous
Oh,
policy, you know.
isn't
And
it illegal to be known at this point? It's only anonymous
it's only
donation
anonymous.
there. Yeah.
Yes,
Mm-hmm.
only anonymous. And it's interesting there too, because in Spain, the physicians choose the donors
Mm.
based on the degree to which they're a phenotypic match to the recipients.
Oh, okay.
So as a recipient, I couldn't go and look at a catalog, for example, of donors and
Mm-hmm.
say, oh, I want that
Mm-hmm.
one. But what would happen is in some clinics, they have what's called phenomatch, which is sort of like a facial recognition program, and it
Wow.
actually measures the structure of your face, and then measures the structure of a donor's face in their database, and tries to
Yeah.
match people based on
Wow.
what much they look like each other, the hair color, eye color, blood type, and so on. And that
Wow.
whole system is built upon this notion that people won't tell,
Mm-hmm.
that that it
Mm-hmm.
will remain a secret, and that this
Ooh, that's a sophisticated secret keeping system.
exactly.
Wow.
And when I've had these conversations regarding, well, you know, when it comes to donor anonymity, how are you going to handle it when, you know, 23andMe hit Spain? And I keep hearing things like, well, you know, it's not a part of Spanish culture, so it's not going to
Not
be an
yet.
issue for us.
Yeah.
And it's like, well, culture can change pretty fast, and
Pretty
as
quick.
long as
Yeah.
technology, you know, technology
Oh,
drives culture change all the time.
yeah.
And so, but that's really interesting to me. And so there has been some discussion about possibly changing the policy
Okay.
surrounding anonymity, but I don't think that's really being considered seriously yet.
Oh
And
boy. Oh
I've
boy.
really got my eye on what's going to happen when you know 23andMe gets in
Yeah.
the game, or Ancestry, or any of that. And
Yeah.
people do use it in Spain to track, for example, adoptees that might have been put up for adoption,
Mm-hmm.
or stolen children from the Franco era
Mm.
have used DNA testing to try to find their roots.
Mm-hmm.
So it's not
Mm-hmm.
highly unlikely that if somebody finds out their donor conceived, they might do the same.
Yeah.
So, but we shall see.
Yeah. And then you have also people traveling to Spain too for,
Absolutely.
yeah, to use anonymous donors, or traveling to, other places,
Yeah.
Prague, Russia, places like that. So there's,
Ukraine is a big one. Yeah.
mhm.
Yeah.
Yeah. And people from Australia do travel because they cannot do donation conception in Australia. So they travel abroad as well.
Yes, some do. I mean, you can do donation in Australia, but it's required to be open,
Yeah.
and it's required to
Yeah.
be altruistic. So you're not going to be
No
able to
paid.
pay a
Yeah.
donor $10,000 usually in Australia. I have talked to donors. I've actually interviewed on camera donors that have come to the United States from Australia. Their recipient parents have come to the United States from Australia.
Australia. Yeah.
They've done it here, you know. So that's
Yeah. Yeah. On the soil here. Yeah.
Mhm.
Yeah. Wow. That's amazing. So
Yeah.
yeah, so known donation, and yeah, it's going to be so interesting to watch to see how things unfold. And
Mhm.
it's certainly changing here really quickly, because I just in the past 2 years seeing how the technology has influenced, and also social media, how it's changed
Right.
perspectives and attitudes around
Mhm.
donation conception, kind of enable people to talk about it more,
Right.
and to try to confront some of the stigma and the shame that's associated with it.
Exactly.
My biggest concern is obviously for the children, that they don't internalize that shame and stigma that the parents are carrying. So,
Absolutely. Yeah.
yeah.
And I think that's one of the things that I've often heard from other therapists as well, is that, you keep secrets about things that you're ashamed of,
Yeah.
and, and why would anybody feel ashamed of having brought their beautiful child into the world in whatever way that they could? And, some people
Mm-hmm.
have access to sperm, some people have eggs, some people have a uterus, and if yours isn't functioning, there's always ways of making a baby.
Mm-hmm.
But
Yeah. It's so many narratives from a long time ago that we're still overcoming,
yeah,
so changing those narratives is a hard thing. It's a long process. And especially when you have so many different moving parts too, and we're all kind of separate from each other. And, the more we can kind of come together and work on behalf of these families, and not just the recipient parents, but the donors and the children, like, have a voice that speaks for all, and we're trying to do best policy for everyone involved. That's
so,
possible. I have to believe that's possible. I mean,
oh,
it has to be.
I think so. I mean, that's what kind of
Yeah.
keeps me going is,
Mm-hmm.
I have, all this data. Well, what can it, what can I do with the data I have? Or what does the data I have say about what best practices might look like in a
Mm-hmm.
variety of different areas, both in terms of,
Groundbreaking.
yeah,
Mm-hmm.
how donors, can, for example, one of the questions, like what are the things that might improve your experience with medical care, with agencies, and so on. I think that's really important information for
Mm-hmm.
professionals in the industry to have, so that egg donors are receiving um, the best care possible. Possibly the open donations might be the best thing for families created in this way. I mean, there's a
Mm-hmm.
lot to discuss, and a lot to be discussed and gone over, and to think
Mm-hmm.
about, about
Yeah.
how things could be done in a better way. Yeah.
I think you could have facilitators that
Yeah,
help people walk through the process. The doctors don't have time to be the
absolutely.
psychological and social facilitators of this. So I think
Yeah,
there's room for that. Just a more of a boutique approach to fertility medical treatment in general, rather than the medical model just isn't working. I've
yeah,
had so many clients that are really traumatized by their experiences that they've been through with treatment, and I'm not blaming anyone. I'm certainly not blaming the doctors, but it's just because the nature of this is so sensitive and so primal and so life and death, that it's just tender. It's
it
just
is.
tender. And so I think that we have to start really realizing that,
Yeah.
and adjust the model to serve families better. So
Well,
that's my
exactly.
goal.
And I think that what you hit the nail on the head when you talked about, like, how tender it is. And the
Mm-hmm.
thing is that, a lot of doctors that I've spoken to, for example, see themselves, and somebody have even said this, as like sort of mechanics in a way. They're there to fix a problem. Okay, you have eggs that don't work. This person has eggs that work. Where you place one with the other, and it's like replacing a battery in a laptop. I saw it written in an article. There was an article written about mitochondria DNA, for example. But anyway, so it's a very mechanistic way of looking at the body. And that's part of medical training, is to look at the body in this mechanistic way, in terms of how do you fix whatever it is that's going wrong, replacing one part with another, a kidney, a this and a that. And I think, and doctors necessarily must be focusing on, how do I fix this problem?
Yeah.
That's their job,
Yeah, sure.
And so some might have more sensitivity and a better bedside manner than others, that uh,
Mm-hmm.
some people are just more sensitive than others in any kind of profession. But I think, like what you said, is that having other people that are facilitators of this process, that brings the humanity more into it, I think could be something that could be fruitful and helpful to people,
Oh, for
because
sure.
people don't have time to deal with somebody's emotion. you
Yeah,
know
yeah. It's so true. It's so true. And I think that's, um, yeah. And just even for, now I won't go on a soapbox about that, but yeah, it is important so that we continue to look at the practice and see how we can just help families to make it better. So yeah, and you're doing that with your research. It's going to be, I don't have enough words to express how excited I am about this. And I know it's going to change the way that, we look at things in a positive way. And that's what it's all about, is helping families, helping donors, helping, I think there's a lot of fears that when we start talking about looking at long-term research or really getting into the data, I think people get really afraid that, oh no, this is going to mean the end of egg donation, or donors are
Right.
not, or even with openness, there's this fear that if you require openness, no donors are going to donate. You know what? I
And that's
found that not to be true. That's
yeah.
not true, people. It's not true. So we have to quit believing these are fears. It's just fear talking.
Right.
And the same goes for research, is we don't need to be afraid of it ending. It's only going to make it better.
Right. And
Mm-hmm.
that's, and like you said, there is, and I keep hearing it from the medical world all the time, is that, oh, we're going to lose donors if we have a egg donor registry, for example, or a sperm donor registry, or any kind of registry, because they'll be concerned about privacy. And that's like, well, no, actually, in my data, I can tell you that 95% of my donors want a mandatory registry,
Mm-hmm.
and another amount want a voluntary registry, or something. That's not the right right number, but a high number actually want a registry, or they want to have contact, or they want to at least have updates about the children born from their eggs and
Mm-hmm.
so on, or possibly a picture, or just be notified that there was a live birth. And that actually, for many of the donors, enhances the process. The donors that I find that are the most
Yeah.
satisfied with the process also found out, 9 months later that there was a live birth, or that there was a pregnancy, a conception within a few weeks. And donors have told me point blank, I cried tears of joy knowing that I contributed to that, because that
Oh,
made it all meaningful to me. Like, yes, I needed the money, but knowing that there was this other thing, that
that
I
happens. That
did
they,
that's
yeah,
a huge sense of satisfaction for a lot of donors.
yeah.
That keeps them, and actually can sometimes keep them coming back to donate again, because that feeling is so intense.
Yeah, it
So,
goes back to that existential meaning. And if
exactly.
somebody can't, they want to give in that way,
Mhm.
and to make a difference in the world, and that's the way that does provide a lot of meaning to
Yeah,
them. And yeah, you're right. It helps to, if they need to pay off their debt, or if they need to they want to go to college, or they want to buy a house, put a down payment on a house, it helps. It's a win-win. So
yeah.
it's, yeah,
And
yeah.
the interesting, one of the things that I see in the United States too is we obviously we compensate donors quite a bit,
Mm-hmm. Mm-hmm.
and I've seen as low as a few $100s to as high as $250,000, with
Ooh,
most between 7 and 10.
ooh,
So
yeah.
that's an interesting piece in
Mm-hmm.
and of itself. But that said, you know, the fear that you're going to lose donors if you have a registry, well, not only is that not true because they actually do want a registry, but that's also not true because the financial incentive is enough to still have plenty of people coming forward to provide
Yeah.
eggs,
Mm-hmm.
uh, out of
Mm-hmm.
financial concern, even if there's mandatory identity release.
Yeah.
So
And I will tell you, I was skeptical at first. So when I was first interviewing donors 10 years ago, and I knew that if it was just a financially motivated donation, that you could disqualify them. Because that's the rule. The ASRM rule is if they clearly just want the money, you can disqualify them psychologically for that reason. And so I would look for it because I'm a rule follower. So I'm trying to follow the rule. And I was a little bit skeptical, to be honest, at first, and thinking, are people just going to lie to me and tell me what I want to hear because they know they have to give the right answer? So I'd be looking for that. And what I found over the years is it truly was both. They
yeah,
truly were all altruistic,
yeah,
and the financial was as an incentive too. So
exactly,
it was both, and I was
exactly,
looking to not believe that.
yeah,
So
yeah,
it
yeah,
that's when I realized that it is such a big thing that people want to do from their hearts, and to make a difference in someone's lives. So
yeah. I mean,
yeah.
for the most part, like you said, in my data too, it appears to be both for most cases. There are some that said, you know, like I have one donor, she's like, I donated 17 times. I needed the money. I used it for a down payment on a house, and it was transactional to me.
17 egg donations?
She did 17 cycles.
That
And
you're only supposed to do 5 max.
you're supposed the ASRM has a guideline that says you're not
That's a
supposed to do more than 6,
mhm.
but it's just a guideline, so it's not a hard and fast rule. So
Yeah.
a lot of clinics will go beyond that, and egg donors will
Like
also.
triple beyond that?
I've heard as high as 19. That's
Oh
the
my
highest
goodness.
I've ever
Recently?
heard. Mm-hmm.
Oh my
Yeah, so
goodness.
that is also something that I think, long term vision is that if we had a national registry, that would help fix that issue.
Okay. Okay.
But and on the other hand, also, uh, I had another thought
And I
related
think
to that.
keep that in thought. And I think what's important for those listening to know is that donating your eggs is not like donating your sperm. So
Exactly.
19 cycles of an egg donation is pretty invasive. You're taking a lot of medications,
Yeah.
introducing a lot into your body. So it's much more invasive procedure.
Yeah.
And we just, like, again, don't have the long-term information yet, but we're going to soon have
Yeah.
the long-term information on what that does. Yeah.
Yeah, and so my point was going to be that in some cases the clinics don't follow the guideline,
Hmm.
but in other cases also the donor might not necessarily tell the
Yeah.
clinics, oh, I
Yeah.
did 6 donations already, because
Hmm.
because of the financial incentive. So it's a complicated issue, but yeah.
Yeah. Yeah. And it's not, the clinic may not be really encouraged or have a huge desire to go and investigate much further. Not that they would get information because it's confidential. You know,
Exactly.
these medical and psychological information is confidential. So yeah, it is hard to actually enforce.
Yep.
So yeah. Wow.
Whereas
Well,
in Spain they have a registry, and so
okay.
in Spain you cannot go beyond 6 live births in a geographical area.
Okay.
So for example, but you can do 6 live births in Spain. You can do 6 live births in France. You can do 6 live births in the UK.
Oh, yeah.
They're in Spain, so they're not limiting the number
Okay.
per se.
Okay.
That's highly unusual. You know.
Is that to limit half siblings
Yes.
and in proximity to each other that live in proximity? Okay.
Consanguinity. Yeah.
Yeah. And that's another thing I would like to mention is that when doctors programs have embryo donation programs, one thing they are not being counseled on a lot of times is that their child that's born through embryo donation could have a full half sibling in the same area, geographic location as them. So if that, if their embryo donation was done through that clinic and they were a patient in the same area, then you can have kids going to the same school. And that I have interviewed donor conceived individuals who did go to the same high school with their half sibling and didn't know it until they were adults. So it can happen. So it's just, again, it's not something to be fearful of. It's just something to know about and be informed about.
And that's another reason why it's so important to disclose to your child that the donor conceived, because at least that will be on their radar when they're, teenagers or adults, to think, okay, if I meet another donor conceived person and we start dating, we should somehow check to make sure we're not biologically related.
Yeah, exactly. Can DNA test ancestry.com or 23andMe. So
are we going to get advertising?
I know, right? I wish. No, but yeah, that's a whole nother topic. So, because there are ways that they think that they can improve the process of when half siblings find out, or people find out they're donor conceived by accident, that these companies can direct them to resources and things like that. So yeah. But well, this was so great, and I know we could talk about so many more things, but I don't want to keep you and take advantage of you too much, because I know you're busy and we're both, it's the end of the day. So, but I'll definitely have you back, and we'll keep talking and keep sharing.
Absolutely.
Yeah, and I know I'm going to get tons of questions, so that I can come back to you with questions. And
and I'd love to see what the questions are too, because I'm curious about what people are curious about. So I would love to know what people's questions are. So that sounds
awesome.
Great. Yeah.
It was great talking.
Great talking to you too, and I look forward to talking again soon.
Yes, me too. Thanks for listening. If you would like to follow for more content, you can go to my Instagram and Facebook account at Jana Repnow LPC, or follow 3MakesBaby on Instagram. You can get a copy of my book and the companion workbook to 3MakesBaby on Amazon. If you like this podcast, be sure to like and subscribe. Have a great day.